welcome to the show. You're watching Tech 24. I'm Julia Seeger. The number of COVID-19 cases is slowing in China, but growing everywhere else in the world. From AI to robotics and even math, in this edition, we tell you how technology can help manage the epidemic. The only positive outcome of this outbreak seems to be that it offers insights into how innovation and technology are better equipping us to handle future public health emergencies. And we've all seen researchers and biologists in laboratories perform transfers of fluids when conducting their tests. We show you how this repetitive move has now been automated thanks to the French company Flugent. Now, as the number of cases of the new coronavirus are increasing here in France, hospitals are bracing for a potential influx of infected patients in the weeks to come. But some medical facilities have already equipped themselves with AI-driven solutions to help them plan the patient flow. The algorithm is developed by a Swiss startup called Caliphs. And for more on this, I'm joined by its CEO, Tony Germini. Thank you very much indeed for being with us.
Hello, everybody.
So tell us, how does your algorithm work and how is it helping manage patient flow?
Our algorithms are deep learning based. So they get information from multiple sources provided by the hospital. We then, thanks to this data, we create signals. They give us patterns to differentiate information from the past. For example, we are able to anticipate and predict admission, which admission are impact on the hospitalization. That means we are able to give information about the tension in the emergency ward and also information about how many beds the hospital has to provide for this incoming patient. We use data from hospital, of course, and from the weather, from the holidays, from events, and even from seasonal flu. We integrate this information, and our algorithm learns every day. So day by day, it gets better, and we are able to provide information up to 7 days in advance.
Now, does your algorithm still work in the specific case of the new coronavirus outbreak? And what other type of data would you need to feed it to increase its efficiency in the wake of future outbreaks?
So we already, see signals from the regular flu. So this coronavirus flu, it can be compared to a seasonal flu. So algorithm, as said before, learns every day. So in the future, we can even be better organized and prevent and predict this kind of virus. Of course, if we had access to global data, territorial data from the country, live, even better, we will even be better ready to prevent and predict admission for the hospital and for the hospital regionally side.
Tony Germini, thank you very much for your time.
Thank you too.
And it's now time to welcome our in-house expert, Dan and Jay Kattlecar. Hello, Dan.
Hello, Julia.
We've been talking a lot about how AI was able to predict this outbreak of the new coronavirus. It was done by a company called Blue Dot in Canada. But beyond AI, good old math could actually be an even better predicting tool.
Well, yes, mathematical modeling is an important and a useful tool to estimate the progression of a disease, which in turn can help medical professionals, policymakers, and the general public to implement measures for both control and treatment. Now, mathematical modeling involves running these models on computers using specialized softwares in which you simulate different scenarios by using different values of variables. So just to give you an example, a mathematical model was developed by researchers from the London School of Hygiene and Tropical Medicine, and their aim was to assess the effectiveness of controlling COVID-19 through isolation and through contact tracing. So for that, they used multiple variables, key variables such as reproduction number, which essentially is the number of people that can be infected by someone who has a virus. They also used another variable, which is the time from the onset of symptoms to isolation. And using this, they created certain estimates. Now, the other example is from the researchers from Shanghai Jiaotong University School of Medicine. As you can see here, there's a graph that was created by using two important variables, again the reproduction number and the other number which is called the effective reproduction number, which essentially is the amount of secondary cases per primary case in time. And so they also created this estimation, and this estimation was created after the implementation of strict measures in China. So here you have another example, and the Chinese model was run on, or it was created by using the software called R software, which consists of a language and consists of a runtime environment with graphics and a debugger.
And speaking of China, medical responses there to the new coronavirus are being bolstered by technological solutions that are not always privacy-friendly. Using big data gleaned from smartphones, authorities are mapping people's movements and are also issuing a health-based QR code that shows others their status. Olivia Salazar-Winspear has more.
At the entrance to this office block, it's become an automatic ritual. Employees and visitors show a QR code on their smartphones to gain access to the building.
My code is green, so it means I can go in. If it was yellow or red, I wouldn't be allowed to.
The application was designed by Chinese web giant Alibaba. It uses data collected by the smartphone to work out if its user has been in areas affected by the coronavirus or has been close to people with the illness. The QR code now functions as a password. In this town south of Shanghai, it's used at the entrance to residential buildings, stations and the metro. If the code's not green, you can't go in.
It's reassuring. Without this code, it's impossible to know if the people taking the metro or the bus are in good health.
China has deployed high-tech solutions across the country to slow the spread of the coronavirus. This police helmet has a built-in heat sensor, allowing them to visualize the temperature of individuals 5 meters away. In the south of the country, drones hover above cars so that passengers can scan the QR codes, which then log their journeys. In Beijing, this control center is analyzing the flow of traffic to better identify where the risks are coming from.
The government wants to use big data to make the right decisions to fight this epidemic, precise information that can be used efficiently.
But the use of this data does have its limits. 2 weeks ago, when this man downloaded his health QR code, he discovered that it was red for no reason. It turned green 2 days later.
I really don't understand what happened. Since I came back to Shanghai, I hardly left my house. Usually, if it's not sure if someone's infected, their code shouldn't go red. And as a result, I couldn't go into work.
Technological infrastructure which is also feeding the surveillance state, according to this journalist who's been investigating how the application harvests data.
We actually looked at the back-end code that the app was running. And what you could see is the moment that a user gives it permission to access data, it immediately sends a function that says report info and location to police. And then we looked into it, and the police were a key developer of the product as well.
For now, the data of some 50 million users is being handed over to the Chinese authorities.
And let's now take a look at other technologies that are being developed but that don't raise such obvious privacy concerns. Dan, let's start with robotics.
Well, yes, the first example is that of Vichy Robot, which is essentially a telehealth device. It's a tablet on wheels that was used to treat a SARS-CoV-2 patient in the US. It enables interaction between the medical professionals and the patient, and it also can perform certain basic diagnostic functions like taking temperature. The other example is that of Germ Falcon, which disinfects aeroplanes. It does so by using ultraviolet C rays. It has an efficiency of 99.99%. It kills all the microbes, including viruses, bacteria. And the third example is of Little Peanut, which is a robot that delivered food to some of those who were quarantined in Hangzhou in China.
Now, there's a handy wearable device called Biostick that continuously monitors the vital signs of someone so that he can know if he's being infected or not.
Well, yes, it's a single-use device that can rather monitor these vital signs for 30 days. It can be worn on the left side of your chest, and it monitors different parameters like respiratory rate, your heartbeats, and your temperature.
You know, that can be a little bit stressful to have that with you all the time and to be staring down at it. Now, 5G technology is also helping for remote diagnosis of patients in China.
Well, yes, the Chinese telecom company ZTE has developed this 5G infrastructure in which experts from West China Hospital are able to perform remote diagnosis and treatment to 27 hospitals that have coronavirus patients. And the idea is to expand this service even further in Wuhan.
Thank you, Dhananjay Kadalkar there. Let's move on now to Test 24. The device we have on the set of Test 24 this week is set to revolutionize the lives of researchers worldwide. It's called Aria, and it's made by the French company Flugent.
Well, the two features of this device are automation and precision. Automation in transferring liquids from pipettes. These are called reservoirs, but essentially pipettes. There are 8 such pipettes here. Each of them has a capacity of 15 milliliters. And precision, so this device can transfer fluids up to 1 microliter, which is 1/1 millionth of a liter. So it's very precise. And this is important because it, first of all, saves time, it saves a lot of cost, and it frees you, or if you are a scientist, it frees you to do other things while this device carries out the transfer of fluids. Now, inside, I'll just show you here. So there are, you can see all these capillaries enter this valve, and then it goes to the debimeter, which essentially measures the flow rate and volume. And from here, it is then transferred, or it can be transferred to a lab on chip, where you can do multiple tests. For example, you can check if certain cells are tumorous or not.
Thank you very much, Dhananjay Kadalkar. That brings us to the end of this week's edition of Tech 24. But you can watch it again on our website, france24.com. See you soon.